Hello my friends, I am Dr. Firuza Parikh and I am the Director of the Well Women Center at the Reliance Foundation Hospital. Today, let's talk on fertility preservation for many conditions other than what is called elective freezing or social freezing. At the Well Women Center, we have introduced a unique and novel method of freezing ovarian tissue. This procedure has many uses. This is very useful for young women who have recently been diagnosed with various forms of cancer such as breast cancer, sarcomas, lymphomas, brain tumors and other cancers which require chemotherapy. When a woman needs chemotherapy which can be toxic to the ovaries, she may face what is called premature ovarian failure. This will permanently affect her eggs which will get destroyed and she may even reach early menopause. Young girls who have not yet reached puberty can definitely benefit from this technique. There are some children who face the diagnosis of leukemia, lymphoma, sarcoma, brain tumors or are undergoing stem cell transplantation and bone marrow transplantation. These children can definitely benefit from the technique of ovarian cortex freezing. Another important utility of this technique is for non-cancerous conditions where very young girls with some genetic conditions like Turner syndrome, thalassemia, sickle cell anemia, benign ovarian tumors can benefit. Young women faced with a family history of premature menopause can also avail of this unique technique. We have used this technique quite frequently for women having endometriosis. We know that endometriosis can damage the ovarian tissue. While a laparoscopy is being done to clear the pelvis and the reproductive organs which are affected with endometriosis, the gynecological laparoscopist can take a small segment of the ovarian tissue for freezing. This tiny fragment, which can be up to 1/3 of the ovary or the full ovary in certain conditions, is gently cut and handed over to a laboratory where the embryologist will carry out the procedure in the dedicated ovarian cortex freezing lab. The embryologist will very gently dissect the tissue into small fragments and freeze this in a dedicated setup with vials at -180 degrees centigrade. Now, when the woman is cured of her cancer or when the young girl who has been cured reaches adulthood, this tissue is retransplanted into her body. This will have many benefits. Firstly, the function of ovulation will be restored naturally and she may conceive naturally. She also has the option of doing IVF to conceive. The other advantage is that this procedure will delay menopause. I would like to state some interesting facts about ovarian cortex freezing. Do you know that the youngest person who had ovarian cortex freezing was only 2 months old and the second youngest child was 4 months old? Another fact is that more than 20,000 women all over the world have undergone OTC for short for ovarian cortex freezing. We have done OTs for women with cancer, for autoimmune conditions, sarcoma, breast cancer, endometriosis and for elective freezing. If you know of someone who would benefit from this technology, please pass on the message. You could save a life and create a new one.